a third-year medical student, I found that the family physician that I was working with, he just had the most fun with his patients that I've ever seen anyone have. And I found that that resonated with me, kind of being able to build these long-term relationships with your patients over time and help them navigate their health. And I think building that trust is super important. I see all different types of conditions, anything from hypertension to diabetes to thyroid problems. I also have a special interest in the treatment of the active population as well. I have a really good background in terms of exercise prescriptions, a lot of different experiences. And I know that it's a great form of treatment that doesn't require any pills. And I know that with the right exercise plan for the right patient, they can be successful in terms of meeting all those things. As we spend more time away from the pandemic, there are so many people that have been affected or exacerbated in terms of mental health. And I don't think it's just gonna go away. I think we need to treat it and be able to manage it well. And as far as cognitive behavioral therapy, arching with people as to what their main concerns are, helping them through different things, all of life stressors, have the right therapist on board through a referral. I have a therapist myself, and I know for my patients it's super helpful, and I've had a lot of these conversations also with colleagues and looking over the research, so I think it's super important. I think I'm very patient-centered. The communication is very strong, and the ability to listen to a patient, kind of see what their concerns are, and address as many as their concerns as possible, involving other members of the care team as well, kind of being able to include a therapist, other specialists, physical therapist, occupational therapist, if someone is battling an injury. I think it's very important to put the patient at the center of it all, but to also realize that there are other members of the healthcare team outside of just the physician, and I want to be able to be the quarterback of the team to get the patient steered in the right direction, and hopefully we keep scoring touchdowns.